This video will be on Salter-Harris fractures. The Salter-Harris classification system is a method of categorizing fractures that occur around the physis, or the growth plate, of long bones. Correspondingly, they're only seen in children. There are 5 subtypes, and these can be remembered by using Salter as an acronym. Type 1 fractures run straight along the physis and can be remembered by making the S of straight across into the S of Salter. Type 2 fractures run from the metaphysis, or the area above the physis, down to the physis. These can be remembered by making the A of above into the A of Salter. Type 3 fractures run from the epiphysis, or the area below the physis, to the physis, and these can be remembered by associating the L of below or lower with the L of Salter. Type 4 fractures run from the metaphysis through the physis to the epiphysis. These can be remembered by associating the T of through or to, as it involves both the epiphysis and the metaphysis, with the T of Salter. And lastly, type 5 fractures are where the physis is entirely compressed or erased, and we can use the first 2 letters of erased as the last 2 letters of Salter. Here's an example of a Salter-Harris type 1 fracture, and one you might also recognize as a slipped capital femoral epiphysis, or a SCIFE. And we can see that there is this fracture running along the physis, with the epiphysis sitting medial to the metaphysis, and no fracture involving either the epiphysis or the metaphysis. These type 1 fractures often will have a visibly displaced epiphysis, as is the case here, or will show a widening of the physis. This is a Salter-Harris type 2 fracture, which runs from the physis up to the metaphysis. In the case here, we can see that fracture running from the metaphysis to the physis and along the physis, and there is some displacement from the epiphysis. However, there is no fracture involvement of the epiphysis itself. This is the most common type of Salter-Harris fracture. Salter-Harris type 3 fractures are much like type 2 fractures, but they involve the epiphysis instead of the metaphysis. In this case, we can see the fracture runs straight through the epiphysis and to the physis. Since these fractures involve the joint space, they may result in damage to the joint cartilage. Disregarding the fibular fracture, we can see that there is a displaced fracture in the tibula which runs from the distal metaphysis through the physis and to the epiphysis. This is a Salter-Harris type 4 fracture. Like type 3 fractures, due to the involvement of the joint space at the epiphysis, there may also be damage to the corresponding joint. And lastly, we have our Salter-Harris type 5 fractures. In addition to the buccal fracture on the medial portion of the radial metaphysis, when we compare the radial physis and the ulnar physis, we can see that the radial physis space is significantly narrowed. This narrowing is concerning for a Salter-Harris type 5 fracture. These are crush or compression injuries and are very rare. Due to the damage to the growth plate and its vasculature, these fractures may impair future bone growth. And those have been the 5 types of Salter-Harris fractures. Thank you for watching.